And now, Wellness Wednesday, brought to you by Dr. K.
We have our lovely Dr. Kira Tolson with Dental Care of Baltimore here for our Wellness Wednesday.
And today we are talking about oral health and how it affects not only your mouth, but your heart and your brain. That's a little frightening. It does actually.
Yes.
Yeah. I've always heard that there was a bit of a connection, but I guess it makes sense that everything is connected. But what is that connection between, say, your dental care and maybe heart disease?
Yes, so that's a great question, and a lot of people think that it's a myth, and it's not. It's a real thing, and it surprises a lot of people. But decades of research has shown a very consistent increase in heart disease amongst people who have gum disease, up to 40% higher risk. So your gums actually do a lot more than just support your teeth. They're really connected to your overall health.
Okay.
And how can that bacteria in your mouth affect your organs? And how does that even work? Yeah.
Sure. So if you floss or brush your teeth and your gums bleed, first of all, that's a sign of a chronic bacterial infection. Healthy gums do not bleed. And if they are bleeding, that's an opportunity for bacteria to enter into the bloodstream. And once that bacteria enters into the bloodstream, it travels. So in the heart, it can lead to a buildup of plaque in the arteries that support your heart, which of course lead to complications like heart disease, heart attack. Researchers are also showing that there's a link between chronic inflammation in gum disease and conditions like memory loss. And even Alzheimer's disease. So it's important to understand that what happens in your mouth doesn't just stay in your mouth. But the good news is it's preventable and it's treatable. So practicing good hygiene at home, brushing your teeth twice a day, flossing daily, and visiting your dentist at least twice a year can really make a big difference.
Yeah, it makes sense to me that you'd say that it would go right into your stream. You know, people talk about taking medicines and putting them under your tongue because they go into your system faster. So it makes sense that bacteria would do the same. So flip it then. If people have, say, concerns with heart conditions or whatever, should they then check their oral health a little more?
Absolutely. These people are even more susceptible. So if you have a heart condition, a history of heart attack, stroke, or heart valve conditions, keeping your gums healthy is even more important. Always tell your dentist if you have a medical condition. Sometimes, in some cases, we actually work with your doctor and have certain precautions before your dental procedures. So the bottom line is, healthy gums don't bleed. If you have gums that are bleeding, that are swollen or tender, these are signs of a chronic bacterial infection. And it's really important. And it's one of the easiest things to treat to protect your overall health.
Just have to go to the dentist.
Go to the dentist. You got to make that trip at least twice. And I'm just really curious before we wrap up, as we're talking about gum health, and you said flossing is such a big thing, what is your take on the methods of flossing? You know, there's like water picks, actual floss, dental floss. So what is your recommendation?
So I like both. I certainly like regular floss to get through the contacts of the teeth where that bacteria will reside when you get food stuck in there. Water picks are also great, especially around implants or dental restorations. If you have crowns, they're really good at, or a bridge, they're really good at getting under there and just flushing everything out. So using both is actually really effective.
All right. Well, Dr. Kira Tolson, thank you so much, and we appreciate you coming in as always.
Thank you for
having me. Thank you for our Wellness Wednesday.
Wellness Wednesday on WJZ at 9 is brought to you by Dr. K.